Good afternoon, Hattiesburg. Thanks for joining us for this COVID-19 briefing for Friday, December 18th. A lot of things to get to today, including our interview with Dr. Batson, but first we want to start with a piece of city news. It's very important for next week, and that is the trash pickup schedule for the Christmas holiday week. This is something that happens every year, both for Christmas week and New Year's week, where we try to consolidate 5 days of pickup into 3 days. And so I'm going to quickly go through this, and I hope that you'll check this graphic out on our Facebook page as well as our website, and let us know if you have any questions. All right, so let's start with green cans. Green cans are, of course, your inside garbage. Nothing will change about green can pickup day. If it normally picks up on Monday, it will pick up on Monday. Same thing if it picks up on Tuesday. It operates as usual. Brown cans are the first difference. So if your brown can is, of course, brown cans is where you put all of your leaf piles, pine straw, small limbs, anything that is outside goes in your brown can. It doesn't go on the curb, it goes in your brown can. So if your brown can picks up on Wednesday, usually it will pick up on Tuesday this week. And we'll try to get all of those on Tuesday. It may go into Wednesday, but if your brown can picks up on Wednesday, put it out on Tuesday. If your brown can picks up on Thursday, put it out on Wednesday. Of course, the difference for one neighborhood that's different in all of this is Burkett Creek. Those guys always have their green and brown cans picked up on Wednesday, and that will continue this week. The big change, though, is with the blue can, your recycling. If you opt in for the recycling service, if you're in Ward 1, it will pick up on Monday as usual. The other ward that will pick up on Monday is Ward 4, but only if your blue can is picked up on the street. If your blue can is picked up in your alley, or if you live in the Arcadia Sunset neighborhood that uses a different truck, it will be picked up on Wednesday. So Ward 4, you're on Monday unless you pick up in the alley or in the Arcadia Sunset neighborhood, at which point you'll be picked up on Wednesday. On Tuesday, Ward 2 and Ward 5 will have their recycling picked up. And then on Wednesday, of course, Ward 3 will pick up. Now, when it comes to debris or things that are too big for your brown can, like piles that you see out, we're going to put a different knuckle boom in each ward, and they're going to get as far as they can get within 3 days. Which means if you have small piles of things, we really need you to use your brown can because it will make the entire system work more efficiently and we can get to as many piles as possible if you will use your brown can on that. So again, check out our Facebook page, check out the website, hattiesburgms.com. All of this is on there. If you have any questions, let us know. The one thing we would ask is for your patience and understanding. Our crews are working really hard this December. And anytime that you try to consolidate 5 days of pickup into 3 days, you're going to have mistakes. You're going to miss some folks. Please don't take that out on our guys. Let us know and if there's a problem or if you're missed, and we'll try to correct it. All right, let's go on to today's numbers. We'll start with hospitalizations. 102 people are positive for COVID today between Merritt Health Wesley and Forest General, with another 1 under investigation. And of those 102, 30 are in the ICU right now. As you can see, we did come down just slightly. We got to over 110 a couple of days ago. We're glad to see that number come down, but we are still incredibly maxed out right now. I know our hospitals only have a few rooms as of this morning on the acute side as well as the ICU side, so we really need to keep this in mind as we go forward. Statewide today, there were 2,507 new cases reported with 34 new deaths. None of those new deaths came from Forest or Lamar counties. However, in terms of positive cases, this was the third day in a row that we had over 100 cases reported between our two counties. Forest County reported 70 new cases, Lamar County reported 36. Since this began, Forest County's total now stands at 4,712 positive cases, Lamar County's at 3,646. Our 5-day average, of course, got really close to 100, and still might get up there again. The last 3 days, we've been at 100 combined. This does not bode well for us going into January. The inside 14-day number, another tough story for us today. This is the number of people who've received their positive test result within the last 2 weeks. The Forest County number is now up to 657. The Lamar County number is up to 543. So again, that's right at exactly 1,200 potential active cases in our community right now. And that's 8 days in a row that we have set new records in terms of new potential positive active cases. Just compared to a week ago, we were at 563 inside 14 days in Forest County. That number now stands at 657. In Lamar County, that number is at 469 a week ago. We're at 543 today. So an increase all the way to 1,200. First time we've been at that number since this pandemic began. Hospitalizations, again, down slightly, but well above what our hospitals can tolerate long term. ICU admissions down by 3. Our goals continue to be protecting the vulnerable, people over the age of 60, people with underlying or chronic health conditions, preventing overrun of the healthcare system by slowing the spread, and of course prioritizing public health while allowing the private sector to find that functional normal and continue as they are. So this morning we put out a call for questions for Dr. Brian Batson. Of course, Dr. Batson is the new CEO of Hattiesburg Clinic, and he has been one of the handful of doctors that's kind of really spearheaded our response to this pandemic since this began. He is somebody we talk to on a weekly basis, but we wanted to get your questions about the vaccine, about new therapeutics, about whatever COVID-related matters you might have on your mind. And so there were several good questions presented, and so now we're going to go to that segment, our conversation with Dr. Brian Batson.
We're glad today to have Dr. Brian Batson from Hattiesburg Clinic, who has really spearheaded most of the clinic's response since this started on day one. And so we reached out to a lot of folks on Facebook and asked if they had questions concerning where we were in the pandemic right now, but also where we were going with the vaccine and other therapeutics. And so we're glad to have Dr. Batson with us today. And so I'll jump right into it. I know that every Wednesday on our call that we have with you and so many other folks, we hear a lot about the statistics, and right now we are very much trending in the wrong direction at the worst possible time. Just today, we learned that we've added another 100 cases for our 2 counties. We know positivity rates are up, average age is up, hospitalizations have topped 110 this week for the first time in our healthcare system. But beyond the statistics, I know that you have spent at least one night covering for folks in the hospital this week. And you're the CEO of the clinic. What are you seeing right now on the ground when it comes to COVID-19?
Yeah, you're right. It is unfortunately a pretty dire situation as we come to work every day. We learn the new challenges that we face and the unexpected ones that we never have had to talk about or think about before. So you plan, you anticipate that every day is bringing a new set of challenges with, as you mentioned, the positivity rate at levels we haven't seen before, and the number of new positive cases that are happening every week continue to rise. And all that happening while those same things are occurring in our healthcare population, where we're having more healthcare workers contract the virus and have to be out of work, and trying to patch those needs throughout the facilities and the organizations where we want to continue to be able to care for patients. So it is extremely stressful right now, and we are doing our absolute best, not only at Hattiesburg Clinic, but the hospital, Forest General Hospital and Merritt. I know Samurai and all the other clinics are feeling the same strain that we are.
Yeah. And over the past few briefings that we've had on Wednesday, we know that there are a couple of new therapeutics that are out there that are and I know that Hattiesburg Clinic did a lot of things right on the front end to get their hospitalization rate lower than the national average. But now we have a couple of new therapeutics that potentially are helping with some more with at-risk populations. What are some of those, and kind of how have you seen them work in our health system?
Yeah, great question, and you're right. We were very encouraged a few weeks ago when some new medications were approved by the FDA to treat COVID on an outpatient basis. Again, other tools we have at our availability to try to prevent hospitalization, antibody treatment. These are infusions that we can provide patients on an outpatient setting. And there's a specific subset of patients that qualify for these. So patients who do not need oxygen therapy, but are having mild to moderate symptoms. These are, as I mentioned, infusions. They take about 60 minutes, but then patients have to be observed for another 60 minutes after that. These are provided to us through the Department of Health through allocations as they are distributed throughout the state. They are free to the patient. The medication is free to the patient, which is also encouraging. But as I mentioned, not every patient meets criteria for it. It's used in specific criteria for those patients who are at highest risk for hospitalization and for complications of COVID.
I mean, are you seeing some like positive outcomes that maybe you didn't see back in April and May?
Yeah, we are. Our experience thus far is limited, but we have seen good experience with these new options, these new therapies. As you mentioned, with our coordinated efforts, we've been very fortunate to have low hospitalization rates prior to even having these, just by this organized approach that we've taken with case management and trying to be aggressive and keeping people out of the hospital as best we can. But the addition of these new therapies has appeared to add to our ability to keep people out of the hospital. And that's crucial for us as a health system and as our community to keep as many people out of the hospital as we can, because the beds are so sparse and they're limited, and anything we can do to keep people from needing to go to the emergency room or the hospital is just added relief to keep those beds available for those who really do need.
And obviously this week was a big moment for the fight against this pandemic with the first distribution of vaccine to healthcare workers. And where are we right now among I know you can speak to Hattiesburg Clinic, and I know we've heard from Merit, but also Forrester. Where are we in terms of how many folks are getting vaccinated, and are people taking them?
Yes, we are extremely encouraged and excited about the news with FDA approval of the Pfizer vaccine. And as you probably are aware, Moderna continues to make its way through this approval process. Forest General and Merit hospitals received their shipments earlier this week, and this is a phased process. So the CDC has outlined a phased process where phase one is where healthcare workers, frontline healthcare workers, and residents of long-term care health facilities will be those that first receive the vaccine. So this week, through the hospitals, many physicians and healthcare workers, frontline healthcare workers, have received their vaccines. We've been almost stepping over each other to try to get in line for the vaccine. It's been a great, just a glimpse of hope into the future of what we can start to see a different day in this fight. It's still long from being over. Don't get me wrong, it's still a long way, but this is at least a step that we hope will be an important one in ending the pandemic. As far as timelines go, as I mentioned and as you said, the hospitals have received their shipments, their initial shipments. I had a conversation with the Department of Health yesterday. Mississippi Department of Health continues to work their way through deploying the vaccine to other hospitals throughout the state. I had a conversation with a friend last night who is a physician in the northern part of the state. He works in a more rural hospital, and they have not yet received any vaccine. So as I understand it, the Department of Health is continuing to work through this first phase of deployment, 1A, if you will, of getting it to the hospital workers, the frontline healthcare workers first. Then, after that, it will become more widely available to other healthcare workers, like those in outpatient settings like Hattiesburg Clinic. But rightfully so, the priority is first to get it to the hospitals.
Yeah, and I've talked to a couple of long-term care facility managers. They anticipate within the next 2 weeks they'll start getting some for their workers and for their residents. But and I know that you're on the Hattiesburg Clinic and you're not at the State Department of Health, but when do you think that there could be the next, I guess, being senior citizens and other at-risk populations, when do you think that they might have widespread, I guess, vaccine availability for the senior citizens at large in our community?
It's it is very difficult to determine or even guess at this point, but I'll give you my best stab at it. We know that the healthcare facilities have not all been given vaccine yet, these hospitals that I mentioned. We, as best I understand from the Department of Health yesterday, it will probably not be until late January, early February, even until outpatient health facilities will receive the vaccine, like Hattiesburg Clinic. So while we have plenty of doctors and nurses who are anxiously awaiting the ability to get in line for the vaccine, it will still be weeks before that is made available to us at Hattiesburg Clinic for those people who don't see patients in the hospital. Then, of course, after that, once all those needs are met, then it will move to phase 2, which will be more the general population, the higher risk general population, the elderly population, which, as best we understand at this point, would be late spring, early summer. So we're several months still before a vaccine is made available to the general public. Now, that said, we have certainly seen some reports that may be happening differently in other states. There's a lot yet for us to know.
Yeah, and I know that you're planning on getting yours this week. Have you seen any side effects? What are the main side effects from taking this so far?
Yeah, I got mine this morning. It was a great day. I was very excited. I skipped over there. It was great. I left the house this morning. My 10-year-old asked if I was scared, and it was a really exciting day at our house to think that I could be fortunate enough to get this vaccine with somebody who's working to help take care of these people. For those other healthcare workers that I've talked to this week, they have said that they've had a little arm soreness. They said it's a little more than a flu shot, but a lot less than a tetanus shot. So if you've had either of those, that was the analogy that was given to me. And I had mine this morning. I feel fine. I feel better than fine, just with enthusiasm and hope for some improvement.
And getting vaccine within less than a year of when it came to our country is nothing short of remarkable. With that rapid development comes some fears and confusion and even some conspiracy theories. And some have questioned what's in this vaccine. Some have referenced, unjust chapters in medical history in our country, like the Tuskegee syphilis experiment. What are legitimate reasons that people have been hesitant to take the vaccine in the first place? And what would you say to someone that has some hesitation or someone hearing some of this anti-vaccine rhetoric?
I think it's certainly understandable that there is anxiety around this. As much as anxiety as there has been about the virus, this is a new chapter we're facing. And I think that's understandable that people are nervous. To that end, we recognize that even within our healthcare workers and our physicians. At Hesler Clinic, we hosted a virtual town hall on Wednesday night that I chaired, and had 10 physicians within their fields of expertise, including infectious disease and OBGYN and allergy and immunology and hospital medicine, and a pediatrician, to bring their perspectives to the medical science as we understand it at this point, and offered this to our physicians and advanced practice providers at Hesler Clinic. We had over 200 attendees for this virtual town hall, where we spent an hour and 15 minutes trying to educate each other, educate our peers, our physician peers, on how this vaccine has been studied and developed and now deployed. I think the thing that's really important to understand is the technology that has been using this vaccine has been around for 10 years. It's been studied a lot, and certainly it's been a more rapid cycle. But part of that was because of the technology being able to produce vaccine in a more rapid fashion. And then another thing that I think is really important for people to understand, and how rapid this vaccine became available, was the fact that the vaccine was being manufactured all while the clinical trials were being done. So we didn't have to wait for the clinical trials to be done and then the vaccine start development after that. So that helped escalate this availability significantly. Thousands of patients have been volunteers in these trials, and we owe them a great debt of gratitude for participating in the research, and have gotten great news from that research. Naturally, as with any new vaccine or any new medication that's been studied, there are potential side effects. We heard about those very quickly from the UK, and the allergic reactions that 2 patients had. There's ongoing investigation and study about that. And for everyone who gets the vaccine, like myself and my partners who have received the vaccine this week, we're part of the ongoing study to make sure that we understand it as best we can.
Okay. What are the differences? We've heard of Pfizer vaccine, which is what you got today, and what people are getting now, and Moderna's, I guess, knocking on the door of FDA approval right now. What are the differences between the two, and when the time comes when this is available to more people in the late spring, will they have a choice, or will it just be you go for your COVID vaccine and whatever one you get, that's the one you get?
So very little difference between the Pfizer and Moderna vaccines as far as from a medical standpoint. They are both the messenger RNA vaccines and have very little fillers, if you will, to help for the vaccine. They're both a 2-shot series. The biggest differences are really the handling of the vaccines. You may be familiar with the Pfizer vaccine. Has to be stored at very, very cold temperatures. Moderna also still cold, but not quite as cold. So the freezer requirements are different between the two vaccines. And then the other difference is that the time window between the first and second vaccines is slightly different between the Pfizer and the Moderna. As far as our ability to pick, if you will, which vaccine is available to us, a lot of that is going to depend on how many vaccines do become available in the manufacturing of those, and how those decisions are made through Operation Warp Speed and Department of Health as they deploy those. As it stands right now, for us at Hattiesburg Clinic as a facility, we anticipate we would get, just as a hunch, the Moderna vaccine for our employees, simply because we do not have the minus 80-degree freezer. So some of it's a logistics thing on which ones you can accommodate.
All right. And once a population becomes eligible, so we get to the late spring and senior citizens and people at risk, will the clinic reach out to them, informing them that they're now eligible?
Yes, that is the absolute plan. As we move into phase 2, we will have some better guidance from the Department of Health as to how many vaccines we will get, and when we are able to know how many we get, we'll be able to better define which populations we start with and then roll from there.
I know this goes beyond kind of your scope as a provider, more to a payer issue, but have you heard what insurance plans on doing this, or Medicare or Medicaid, or what about folks that have no pay source?
The vaccine itself is at no cost to any of us through Operation Warp Speed. There can be, of course, some administration costs, but the vaccine itself is free to us.
And once someone receives the vaccine, is it important that they continue wearing a mask and social distancing? Speak to that if you can.
Yeah, there's been a great amount of conversation around this. In fact, this was a point that was discussed a lot at that virtual town hall I mentioned earlier this week. The vaccine was studied to define, does it protect the individual from getting the disease? We do not have enough evidence to say whether or not someone who's been vaccinated can transmit it to someone else, i.e., can you still be a carrier or a vector? So to that end, the recommendation now is, even though one has been vaccinated, you still need to wear a mask and practice social distancing and hand washing as before.
All right. If someone's already had COVID, do you think that should they go ahead and get vaccinated as well?
Yes, CDC recommendation on that is that patients who have had COVID do indeed need to be vaccinated or should be vaccinated. The only difference there is that you should generally wait the 3-month window after having COVID before being vaccinated, as there's still felt to be a good amount of immunity for at least 3 months after having COVID, that you have antibody levels to protect you for 3 months. And while there is still a vaccine shortage, that those people who have had COVID wait the 3 months until they get their vaccine.
And do you think, is this going to become, like every year there's a different flu shot available? Do you see COVID mutating as quickly as the flu, and do you think this will be an annual event for us getting the COVID vaccine?
We don't know the answer to that yet. This will come with time as we learn more about what the virus does through time, and also the prolonged amount of protection that the 2-shot series may provide us. So we don't have all the answers to that yet. But we will certainly continue to learn more as more people get vaccinated, and as the time passes between when those trials were done. The participants in those trials, at least I can speak to Moderna, are being studied for 2 years. So through a scientific method, we will have better answers on to those questions right there.
And kind of a non-vaccine related question, but once you've had COVID, you're out of your quarantine period. Do we know how long your actually sort of natural immunity occurs? And if someone's still experiencing prolonged symptoms, like whether they still have a cough, are they still carriers? Are they still contagious?
So once someone has been diagnosed with COVID, it is still felt that the 10-day window is the contagious, quote unquote, the contagious phase. And after that 10-day window, as long as symptoms are improving and fever is gone, that being contagious is at a minimum. The window of protection after having COVID is thought to be about that 3 months, where we know that antibody levels to COVID remain at a level high enough to protect from reinfection. We do know that reinfection exists, but it usually occurs after 3 months. That second infection is typically what we've seen has not been quite as severe, but it is real and it can happen. But in the cases we've seen and what's been reported around the country, it usually is not going to occur within the 3 months. Now, if someone does have continued symptoms after 3 months, an investigation needs to occur to see if they've had that reinfection. And then there's the phenomenon that has been discussed about the long haulers or long COVID, where patients never completely have a full resolution of all their initial symptoms, and that is a real phenomenon as well.
And finally, just as we've talked about the trends being in a really poor direction right now. I think right now we hit 1,200 cases between Forest and Lamar counties today inside 14 days. The first time it's ever occurred in this. What should people bear in mind as we go into the Christmas holidays, as we go into New Year's, even with the vaccine that's starting to kind of inch its way out there? How should this alter people's plans over the next couple of weeks?
Yeah, I think there's a lot of excitement, as I mentioned, about these new therapeutic options, and then of course with the vaccine. But we are far from over in this fight. This will continue for a long time yet ahead of us. And while we have these options that are reducing hospitalization and preventing death as best we can, the best case scenario is to never get COVID at all. We don't want anyone to get COVID. And the same measures that we recommended from a medical standpoint as far back as March and April remain in place today. So those things that are common sense, but then those things that do require a little effort, like wearing a mask and trying to avoid crowds and washing our hands and social distancing, those remain cornerstone to our ability to get through this. And while we do have these encouraging steps, the basics remain of the less spread that is out there that we can avoid by taking these measures, the better off we'll be, especially over these next few months that appear to be very scary. And anything we can do, all individually, to help will certainly go a long way.
Dr. Batson, from helping prop up the cough and fever clinic 3 days after the first case appeared to being a reliable source of information for so many people, government leaders, education leaders, we want to thank you for your service. We're incredibly grateful that you're going to be safe now with the vaccine. And we hope that you're able to have a good Christmas holiday season, and your city very much appreciates you. Thank you for being with us today.
Thank you, Mayor.
We're glad today to have Dr. Brian Batson from Hattiesburg Clinic.
I want to thank Dr. Batson for being with us today. Certainly taking time out of a very busy schedule. I know he's had a tough week with a lot of work, especially as hospitalization numbers have gone up, and we appreciate him joining us today. Just so you know where you can get tested this weekend, of course, Cough and Fever Clinic will be open Saturday and Sunday from 8 to noon. SIMRI will be open from 9 to 9 Saturday and Sunday. That's, of course, the clinic near Forest General on 27th Avenue. Merit Health Pediatric Clinic for children and teenagers, open from 9 to noon for walk-ins. Of course, on Monday, CE Roy will be open. And, of course, the health department will be open for drive-up testing in Forest County on Monday. You, of course, go answer those screening questions at covidschedule.umc.edu. And finally, our act of courage. The newest chapter of the Disabled American Veterans has opened right here in Hattiesburg. And they want to let you know that the pandemic, the current economic conditions, and increased veterans' health-related issues have placed tremendous stress and burdens on our disabled veterans and families in the Hattiesburg area. The DAV is currently taking donations to help the chapter provide assistance to those who meet the VA disabled eligibility criteria. Fred Varnado, whom we all know, a well-respected leader in the Hattiesburg veterans community, has recently been designated the commander for this newly established chapter of the DAV. And for all details about the chapter or making donations, please reach out to them. Their contact information is listed right here, and it will also be shared in the post. Another opportunity for us to step forward and help those who have already given so much to us. As we go into the weekend, remember to wash your hands, take care of yourself mentally and physically, wear a mask if you go out in public, do only what is essential, and remember, you're safer at home. Have a great weekend.